revenue and have ideas to raise revenue and to also provide funding for your program. Next slide. So let's take a look at how our state's revenue system works and what it involves. Next slide. This pie chart shows all the revenue coming into our state. You'll see that the largest slice of this comes from taxes. About a quarter is from federal revenue, and smaller portions come from fines, fees, gambling, and other things. Next slide. For today, we will zoom into this largest piece of the pie and look under the hood of how our tax system works. Next slide. So imagine that this pie chart represents the household income of the average Massachusetts household. You'll see that we pay about 10.4% of our household income on average in state and local taxes. Next slide. This amount is actually about average. I think it got cut off a little bit, but you'll see that the US average here is actually about the same at about 10.4, 10.2%. The decimal number is slightly different because it's a slightly different year, but we are about average in the country. And this is contrary to a popular idea that Massachusetts is a high tax state. And this is really because we, over the last 40 years or so, have cut taxes by more than almost any other state. And these cuts obviously affect goods and services that we rely on. Next slide. Diving further into the tax system, we'll see that our tax system is what we call a regressive system. And that's where income earners at the lowest tier pay the largest percentage of their income in taxes. And so you see here on the y-axis that you have three income groups. You have the top 1% of income earners in Massachusetts, the middle 60%, and the bottom 20%. And the bottom 20% pays the largest percentage. 10% of their household income goes to state and local taxes, while the top 1% pays about 6.8%. And at Mass Budget, we talk a lot about ways to make this upside down graph more right side up, ways to make our system more progressive. Next slide. So what are some ways to raise progressive taxes? There are many, but I will touch on just a few that you can keep your eye on. Next slide. Here are a few that are in play most recently. We have actually a report with 14 different options if you're looking for some light reading over the holidays. Here you have 3 examples that Raise Up Massachusetts has been involved in, and there's also a link to their website if you're interested in learning more. One example is increasing the tax rate on corporate profits. Another is recapturing some of the most egregious forms of offshore tax dodging, where multinational corporations move some of their profits into tax havens like the Cayman Islands, and this policy known as GILTI would recapture some of that revenue. And then the third option is increasing the tax rate on investment income from the stock market, from dividends, from capital gains on assets, and other forms of unearned income, which is income that you make outside of work. Next slide. And another option that's longer term to put on your radar is the Fair Share Amendment, or the millionaire's tax. And this would add a 4% tax to incomes above $1 million. It would raise about $2 billion per year for the state, and this is a pre-COVID estimate. And if all goes well, if it goes through all the next steps, it will be on the November 2022 ballot, so that voters like you can decide whether or not we should amend our state constitution to include this millionaire's tax. And if you say yes, then it would take effect in January 2023. Next slide. And I won't get too far into the details of ways to make your voice heard on the state budget and taxes. I believe Shannon might touch on some of those. Next slide. But if you'll recall our calendar, our cycle from before, you'll see here I've overlaid opportunities and ways to ask your legislators, to ask the governor for funding for your programs. And the point I'm making here is there are lots of ways to get involved. It's often very effective to join organizations that are organizing lobbying days or are already tracking these items. You don't have to know everything. If you get plugged in with somebody who is following the budget, then you'll be able to find ways to plug in yourself. Next slide. And just to zoom back out, I think most folks here know that the state budget is really just a powerful tool to shape the conditions in which we live. And so really a healthy state budget is the best medicine. Thank you.
Thanks so much, Monique. We love having you and Mass Budget at all of our events. That was so informative. Next up on our slate is State Representative Kevin Honan. State Rep Kevin Honan is going to talk to us a little bit about his history with housing advocacy at the legislature and where we are now. So with that, I will turn it over to State Representative Honan.
Thank you very much, Jamie. It's a privilege to be here. I'm a state representative from Alston, Brighton, and I was first elected back in 1986. So I've been in the legislature for a long time, and I've had the privilege of serving as chair of the Housing Committee for the past 17 years. And this year has been unlike any other year, obviously, with the pandemic. It's been an absolute crisis. And as we try to keep people stably housed, to keep them socially distant, for health reasons and for every other reason you can think of. I started working at ABCD, Action for Boston Community Development, in the weatherization program. I graduated from Boston College and went right into ABCD. I also coordinated summer youth employment programs. So I have a human service, social service kind of background. I have served, in addition to that, as the vice chair of the Housing and vice chair of the Healthcare Committee. I served on Ways and Means, Post-Audit and Oversight, and I was also the chair of the Boston delegation for 8 years. My sister Claire is a nurse, so we on the front line at Newton Wellesley Hospital, so we hear quite a bit about healthcare issues from my sister. And I want to thank all of you for the extraordinary care you give your patients. And from a public policy perspective, there's no question that hearing from people on the front line helps us craft more successful and important legislation. So I'm delighted to be a participant in the program today. We know that safe housing is a predeterminant for health. Without safe housing, statistics show clearly that if you're not safely housed, you're more inclined to have other health issues dealing there. So a safe, affordable home is critical to a community, to an individual, and to families. Typically, the Housing Committee works on 3 areas. We work on preservation of affordable housing. That would be a bill that we just celebrated the 10th anniversary on, 40T. So in Massachusetts, we have housing that was built with federal funds and with state funds. The state funds are called 13A. So we put through a bill called 40T, which gives tenants an extra 5 years. Expiring use housing, again, is housing that was built with government assistance. And to that end, it had to remain affordable for 20 years, or the landlord could prepay the mortgage, or at the 40-year anniversary date, they could go market rate. And in housing, you have to preserve these units. While we try very hard to continue with bond bills to build affordable housing, you need to preserve the other housing as well that might expire out. I can talk about that later if you'd like a little bit more. It's somewhat complicated. The other thing we work on the housing committee again is homelessness. We work very closely with advocates. So those are the three areas: production, preservation, and homelessness. The production piece comes primarily through the big bond bills we put through. We put through a 1.8 bond bill and tax credits. We work with, the Commonwealth works with community development corporations, nonprofit developers, and private developers. But we try to put money in play so affordable housing can be built. And one of the big costs, of course, is land. So we are always exploring new ways to build more affordable housing near public transit or on the grounds of state-owned land, perhaps housing authority land, to build more housing there. So one of the things we're most concerned about is keeping people stably housed during COVID. This, as I said at the outset, these times are unlike any other times we've ever dealt with. So we put through legislation rather rapidly to protect people from eviction during the initial phase of COVID. So Mike Conley from Cambridge and myself filed a bill to have a moratorium on evictions and foreclosures during the pandemic. And this bill was well received in the legislature. While it usually takes a bill an entire session or 2 sessions to become law, we were able to do that bill in about basically 1 month. And it was a relief to so many of our residents here in Massachusetts. The moratorium expired in October, and now we're working very closely with the judiciary, because they are right there. That's where these cases are eventually going to end up. And mediation is something we're stressing tremendously. We want to protect people during the pandemic. We have legislation as well that's in the Rules Committee, again, sponsored by Mike Conley and myself. I did want to tell you during this time, one of the main things we utilize, and you just heard from Monique, is the state budget. And we had a very successful state budget in the area of housing. Some of the key areas that we focused on were 4.75 million for housing consumer ed centers. In Boston, we have Metro Housing. That's the housing consumer ed center for our community. And all regions around the state have their own housing consumer ed centers. That is the place where the RAFT funding is distributed. So in our efforts to preserve people's tenancies, we put a lot more money in RAFT, 50 million more in RAFT. And the money is distributed by the Housing Consumer Ed Center. So they're going to have to hire some more people and work with that. We also put $8 million increase in the public housing operating budget. We have 50,000 units across the state in public housing, and we work closely with housing authorities in Massachusetts. So we put much needed funding in the state budget for our local housing authorities in Massachusetts. We also did quite a bit more work there on the judicial system and the process. In fact, when a person has an active application for RAFT, their tenancies are protected through this. You can't evict someone who has an active application. And we have seen a lot of cooperation there between landlords and tenants, but we're monitoring this very closely. I don't think the legislature has ever worked as closely with the judiciary as we are now. And Chief Justice Gantz started that, who tragically passed away. This was a top priority for him, and he was a tremendous loss. He formed a massive group of housing activists and courthouse folks to come together to try to help with this problem. Now, Chief Justice Carey and Chief Justice Sullivan are leading the way. We have a meeting with them later this week on Thursday to get numbers. It's critically important that we in the legislature have numbers of how many active cases there are in the court system. In order to make decisions, we need to have statistics. So the judiciary system will be providing those to us. There is a bill called an Act to Guarantee Housing Stability that I have co-sponsored with Mike Conley that seeks to have the moratorium extended for a year. It's in the Rules Committee, and we're always trying to build support for it. But at this point, the Commonwealth's direction seems to be heading in the direction of preserving tenancies through RAFT and through other mediation efforts. So there are a lot of challenges dealing with housing in Massachusetts at the present time. It obviously is very expensive to live here. We had a crisis before the crisis. Before there was COVID, there was still housing problems here in Massachusetts. We are very much dependent, I would say, on the federal government helping us out here. So we would like very much to see a second version of the CARES Act. It's quite frankly necessary for people who are on unemployment assistance, who are having trouble paying their rent. So we are pretty much desperate, I would say, on that, on federal participation, and all across from healthcare to other areas of delivering services. So we really need some federal help, and hopefully help will be coming. Another issue I was thinking, we're talking about the impact of frontline workers on legislative policy, and you folks are on the front line. So I would say to you that I've always felt that the key issue was having a conversation with your own legislator, the person who lives in your community, who represents your community. We just had an election, so there's new legislators coming in. Perhaps you're from a community that has a new legislator, and you should build a relationship with that person. This is about the time now when we determine what bills we're going to file for the upcoming session. So it's a good time to reach out and talk to people who are involved on the committees, like Aaron Michaelwitz is from Boston's North End and represents a great deal of downtown Boston. Monique pointed out that he's the chair of the Ways and Means Committee, very influential, hardworking legislator. We also have John Santiago, who represents the South End. He's a doctor at Boston Medical Center. I found him to be incredibly helpful to me and to other legislators when we are determining what public policy is necessary. And who better to have than a medical professional who's on the front line, who was dealing with COVID patients. It's very helpful to have Dr. John Santiago as part of our legislative team in Boston and in Massachusetts. So again, from a effectiveness of lobbying, it would start with your own state rep and your own state senator. We're in this virtual world now. The legislature meets in a virtual world. We don't go in the State House very much. We've had colleagues who have come down with COVID. So we do quite a bit of work from our homes. We're on constant Zoom calls, 2 or 3 a night, and with community groups, and during the day with legislative matters. So it's a pleasure for me to be here to talk to you about housing, if you want to talk about some more detail. But these are difficult times, and they change by the day, by the way. Even Mayor Walsh reverted back to no more than 10 people can meet indoors. So it's constantly in flux, constantly changing, as was the legislative agenda. And we're pleased that housing did so well in the budget. There are competing interests from education, transportation, to so many other issues, but we're glad housing did quite well in the most recent budget. So thank you very much, Jamie. Appreciate it.
Thank you so much, Representative Honan. We're so lucky to have such a constant advocate for housing and for our families in the legislature. So with that, Representative Honan, I'm going to have you turn off your camera and your mic. We'll move on to our last speaker, who is our Director of State Government Relations, Shannon Moore, who's going to talk to us a little bit about where the Office of Government Relations is going and how you can all get involved. Shannon?
Thank you, Jamie, and thank you so much, Chairman Honan and Monique from Mass Budget, for your phenomenal presentations. It's so good to hear from you both about your perspectives on housing, and we appreciate you taking the time to come educate us on how the state addresses housing and homelessness and all the critical resources that are needed during this pandemic. Again, my name is Shannon Moore. I'm the Director of State Government Affairs at Boston Children's Hospital. So my role on our team is to work with Chairman Honan and other legislators at the State House and in the governor's administration as well on issues that are important to the hospital and to all of our advocates. As we previously mentioned, we convened this series because our office is getting so many questions from around the hospital about what is going on at the state level to address housing and homelessness prevention now that the moratorium has ended. The Office of Government Relations has added housing policy to our upcoming legislative agenda, which we will officially release in the upcoming months. Next slide, please. As part of our agenda for the upcoming two-year session, which starts in January, the Office of Government Relations is committed to working with both our advocates internally and our external partners to support safe, affordable housing with dignity through supporting housing tenancy preservation programs and homelessness prevention resources. As a sneak preview of our legislative agenda, we plan to look very closely into policies that address and acknowledge the role of social determinants of health and how they interact with the lives of our patients and families. I know Jamie already said this definition, but social determinants are the circumstances in which people are born, grow, live, work, play, and age that influence access to resources and opportunities that promote health and achieve health equity. So how do we plan on doing this? We plan to do this by supporting robust funding for the housing programs and homelessness prevention programs that you heard both from Monique and Chairman Honan, rental assistance and safe shelter for families. We will be working with our advocacy partners to better understand how to best address this at the state level. We heard a little bit from Chairman Honan about how important federal funding is going to be towards these policies as well. But on the state level, we're going to be working really hard to see how we can support legislators and policies that will provide direct assistance to the families and patients that we serve. So for next steps, you heard last week at the previous presentation and today about all the different programs that are being stood up and given extra funding and attention to right now to hopefully mitigate the impacts of the COVID pandemic on housing security and insecurity. As Naomi mentioned, there are lots of opportunities to weigh in, and we will be sending periodic action alerts out as things move along at the State House, or should you wish to contact your legislator on your own. One of the things you could do today to make sure you're up to date with your rep is to find out who your rep and senator at the State House. As Chairman Honan mentioned, there have been some changes this year, so please make sure you're up to date on who's representing you. You make sure you know how to contact them so that you can give them a call or email when you feel like there's an issue that's important to you that you want to reach out to. We'll be sending a link with this address, but you can go to wheredoivotema.com and type in your home address, and you can find out who's representing you. It will show you not only who's representing you at the State House, but at all levels of government. As you heard from the chairman, time is running out on his bill that was filed on the evictions and foreclosures moratorium. We will be planning on looking at bills that are filed in January to see where we could best lend our support as an organization and to help direct your advocacy in the upcoming months. So with that, we will be sending out periodic updates as they become available on bills that are filed in January when the new session starts. And this could be on legislation such as the housing moratorium, but also on the budget. And we will send out action alerts when there's opportunities for you to reach out to your legislator or the governor to support various housing policies and programs. So with that, I will turn it back to Jamie for our question and answer session.
Thanks, everyone. I appreciate it. So with this, I'm going to have all of our panelists rejoin us with their videos on and currently on mute. And we've left lots of time because we've gotten tons of questions and answers, or so gotten tons of questions before the session started, and you have all been diligently typing your questions and answers in. So we're going to go ahead and get started. This first question is for Monique. Monique, how can we ensure that ballot questions make it to the ballot this time around? Can you talk a little bit about what that process is like?
Yeah, so I'm not a legal expert, but I think big picture, the next step that's needed for the Fair Share Amendment to get on the ballot is that it needs 50% of lawmakers to vote yes at the Constitutional Convention, which is coming up in 2021. So I think just again, reaching out to your legislators and telling them how important this is to you is one way to do it. And I don't know if Rep. Honan wants to get more into the weeds of this process.
Thank you. Well, there are a number of ballot initiatives. Ballot initiatives are unique. It's been the experience, whoever spends the most money usually wins these debates and discussions. So, but there's no substitute either for troops on the ground. So it's important to be participants, to get out there at your local level, to endorse ballot questions that you believe in, to stand out at the polls and hold signs. But they've become so expensive, so media driven, so advertising on television. We've seen it time and time again. But as far as the Fair Share Amendment, yeah, a lot of organizations behind that, a lot of support for it. So I think Shannon will tell you how to get involved in that. I've seen ballot questions lose because of radio and television commercials, but this ballot question on Fair Share Amendment has a lot of support. So we keep fighting for more revenue to fund the social safety net here in Massachusetts.
Yeah, I think just one follow-up on that is, again, today taking the time to look up who your legislator is. You're welcome to call or email them and just let them know that you hope that the legislature will take up the last vote that is needed to get this on the ballot. And then that'll be up to the voters after that.
Thanks, Shannon. And this is a great reminder that if you're not already on the Children's Advocacy Network, please sign up for our newsletter. We're constantly sending out all kinds of alerts, including how to find your legislator. So that's a great place to go for advocacy. This question comes to us, and I'd be curious kind of what each of your answers is what kind of data do you need or would be helpful from us and the families that we work with in addressing this challenge? So Shannon, I was wondering if you can kind of talk on behalf of the Office of Government Relations. Rep. Honan, I'd love to hear kind of what you like to hear from your constituents. And Monique, as an advocacy organization, I'd love to know kind of how you get that on the ground data. So let's start with Shannon.
Sure. I think, for example, how the Office of Government Relations uses data that we have available would be when we are contacting legislators to let them know, like, hey, here's what we're seeing at the hospital. Here's how many families came to the emergency room saying they don't have a safe place to stay tonight, or that they were evicted and now are looking to us to kind of work with our Office of Community Health and other social workers to figure out a solution. When we bring numbers to legislators saying, hey, we're really feeling the impacts of evictions and foreclosures, and is there any way we can help you use these numbers to really paint a picture around the community of how how the pandemic is really having impacts on the ground. It sometimes can end up in a legislator's testimony, for example, or in the Office of Government Relations testimony, if we were to go to a housing hearing and explain, for example, like we support, additional funding for a program because we've seen the great impacts that it can have on a family. That would be one use of where we would either use data, or sometimes you hear us talking about story banking of a patient's story. If you have any questions about how to story bank, we have plenty of resources about that as well. And I'll pass on to the next presenter with that.
I think, would you like me to jump in right now, Jamie?
Of course, thank you.
I think Shannon answered the question perfectly. If you're interacting with patients who not only have a sick child, but have a housing crisis, these are very impactuous issues and things that the legislature would like to know about. So in terms of statistics, I think Shannon, of course, who has a background working in the legislature, knows what we want to know. She worked, of course, as my chief of staff for a while. Maybe you didn't know that. But anyway, she answered the question perfectly. We in the legislature want to be informed, want to know what's going on. And I was thinking, in addition to staff who interact, employees of the hospital, I was also thinking that it would be important for the actual client, patient, to present themselves to the legislature. And that's what Shannon presented when she said story banking of the individuals. So that's what we need to know. We need to know the frontline experiences, what's going on. We advocate strongly in the legislature for more money to help people who are in need, but you're dealing every day with people who are in need. I also am the state rep from Alston Brighton, so I hear from people all the time who have real serious issues pertaining to housing and healthcare, but I hear mostly from housing issues because that's a huge issue in Alston and Brighton. Thank you.
Yeah, I think so. Not to be repetitive, all of the previously mentioned data points are useful. Our work would be nothing without data. We always want more. And I think one really important thing for us at Mass Budget is we look a lot at numbers and aggregate data. So it's really helpful to have stories, as mentioned before, from patients or from you, to kind of provide a more nuanced picture of what we see from the numbers. And I think another important thing, a lot of what I've talked about through state budget numbers, we ourselves not being on the ground, not providing service, not having members ourselves, we often have trouble getting an accurate picture of what's happening on the ground, and we don't know whether funding is adequate or not without being able to hear from people who are doing the work to say this is enough funding or not. So I think just hearing from folks on the ground is always useful for us. And I would also encourage you as healthcare folks to get involved with Raise Up Massachusetts. I put a link in the chat that I think having validators to make the connection between the state budget and revenue and health is really important and is a challenge to do.
So Monique, the next question is for you, actually talking about the state budget. Is the current allocation in the state budget towards housing needs going to meet the needs that is currently being faced in Massachusetts? And I think I know your answer is probably not. So if not, how much is needed?
So I think the specific answer to that question, I would really defer to housing advocates. And really, I think if you ask housing advocates, you would get a different answer depending who you spoke to. And I would just say this isn't exactly answering the question, but I think one thing we've seen a lot at Mass Budget, just sitting on these coalitions for social service providers and advocates, is that the expectation is so low for what people expected from the state budget, because the situation was so dire. Everybody's just so happy that their programs weren't cut. And what we keep saying is that a better budget is possible. We just need the will to raise the revenue and, to be blunt, not wait for Congress to save us.
Thank you so much, Monique. So the next question is for Shannon. As an employee of Boston Children's, how can I become more involved with GR in terms of advocating for housing protections in Massachusetts, specifically for vulnerable populations such as kids and families?
Sure. Well, I think, I think everybody on this call is probably already on our mailing list, but if you are not, please join. I'll have Jamie send that out after the call as well. You're always welcome to email me or the CAN email if you'd like to talk about ways that you can become more involved. Our office is advocates for quite a number of things. You're always welcome on your own to contact your legislator as well. Legislators are, welcome emails and phone calls, even if you're not calling about a specific bill or program. I mean, you are always welcome to call them and just let them know. I hope that you are working on housing, homelessness, children and families policies. And if there's, I think a patient story that you want help kind of de-identifying and sharing with a legislator, we're happy to work with you on that. I think we want you to feel empowered to contact your legislator, even when the government relations office isn't sending out an action alert, but we will be, doing our best to send out alerts as they're available as well. So I hope that helps.
That's great, Shannon. Thanks so much. And for those of you that are unfamiliar, the Office of Government Relations also runs an advocacy bootcamp class to really help you prepare to speak to your legislator and get familiar with who they are and how to convey your story. So the next question comes to State Representative Honan. How are you monitoring that public housing is being well managed, and how are you taking care of families during COVID that are living in those situations?
Thank you very much. I'm involved out here in Alston, Brighton, with Commonwealth Housing, which is called Fidelis Way, and Faneuil Housing, which is down the street from where I live. Very good question. And what we've done there is it's rather extraordinary. The state has put money through the budget into a computer technology center at Fidelis Way. However, there were 2 shootings there and a stabbing, and the people who live there's a Wanda and a Denise. They're the head of the Commonwealth Tenants Task Force, and they were just so worried about public safety, so worried about the fact that there's no very limited wraparound services. So there is not a youth worker there. So we're trying to, this is in my own neighborhood, I'll talk statewide in a second, but in my own neighborhood, we have Zoom calls with all of the human service providers in this neighborhood, from Substance Abuse Task Force to the Police Athletic League, to the colleges are all on the phone. So we match up colleges to try to get more mentoring, but again, it's during COVID. So we found that in Commonwealth Housing, there is profound needs. Maintenance is always a big issue. I was involved a few years back where we visited 25 different housing authorities. And when you meet with the residents, the number one issue is a relationship with the maintenance team, because garbage piling up and that sort of issue. From a statewide perspective, there's an organization called Mass Narrow. We deal with them. They lobbied for the additional $8 million in services, which we put in the state budget. So they have a statewide lobbying advocacy group called Narrow, and they are in communication with me all the time and with other members. There's so many state reps who started their careers on the local housing authority in their town. And so when I'm dealing with policy at the state level, it's bipartisan. We'll have Republicans, Brad Jones, who's the leader of the Republican Party. He started his career on a local housing authority. So there's a lot of support within the legislature for housing authorities, and the communication is terrific. So when you folks, Boston Children's Hospital, are advocating, you're advocating with the hospital, but then there's statewide groups, Mass Hospital and other hospitals in our city who I'm sure Shannon interacts with, and Jamie, you probably interact with. And there are these team efforts. And I would tell you, public housing in Massachusetts, the local housing authority is certainly a team effort.
Thanks so much. So we have one more question and then we'll switch over into final remarks. So the predicted number of evictions in Massachusetts is astronomical, and RAFT in the budget is unlikely to be enough to prevent the homelessness crisis. So housing stability bill does not pass. What can be done to prevent or ameliorate what will likely be a major public health crisis in our state? And I'll just open that up because I'm sure everyone has a bit of a take on that.
Yeah. Well, I would say mediation is critical at the courthouses. So we need to continue to do that. We need to continue to fund RAFT. Mike Conley, myself, and others obviously wanted to see the moratorium extended, but seems like the Commonwealth's going in a different direction. So we need to fund RAFT again, continue to fund it. We have another budget coming up. So I'm sure Monique is putting together another slideshow, because this budget was delayed so long. And it's a good thing we delayed the budget, and we took quite a bit of money from our rainy day fund to help balance it. But now, Monique, as you know, we're going right into another budget session in January, and I think there's going to be a lot of residual impacts. Obviously, it's still here. COVID hasn't gone away. So we're going to start the budget process again in January for the next budget, and we're going to fight and advocate for more money for RAFT. And it is a problem. There's no question about it. We know it's a problem, and we'll be advocating for more programming, more money, more advocacy, but more mediation. That's my main thing right now, would be money for mediation, money for the consumer ed centers across the whole Commonwealth. There's been, we're worried about the Berkshires and Western Mass. There's a lot of problems out there as well in terms of the evictions being filed.
Thanks, Rep. Honan. Monique or Shannon, any kind of closing words on this?
I don't have a whole lot to add. I think all the resources that the chairman mentioned are really important. I did want to just flag one thing that the chair also mentioned, which is that in the current state budget, the legislature and governor are kind of working out the final details on a way to, if you've applied for RAFT, or I don't know if it's all housing assistance, that your eviction will be kind of put on hold. I know that's not going to help everybody, and I know there's other things that go into it, but in terms of just kind of what is going on right now with that program, that is one thing that the legislature is trying to kind of put a stall on some of the housing court proceedings with people who have applied to state assistance for housing. So it's not a complete solution, but it's a part of the efforts that are being done. So I just wanted to mention that.
Thanks, Shannon. Monique, final words?
Yeah, I think I would echo everything that's been said, but also note that as you all are so aware of, all of these issues are very intersectional. And so I think supporting other related issues, like we hear a lot about the intersection of housing and childcare, and housing and hunger, and all of these other programs that are supported through the state budget that really, create an ecosystem of economic stability, ideally. And I think that's why revenue for us is so central, because with all these seemingly competing demands, it's hard to fund all of that without adequate revenue. So I think supporting all of it would, really benefit families and workers.
Great. Well, I just want to thank all of our panelists today for a really engaging discussion. These are not easy topics. These are
Hey,
not.
Jamie, can I cut? I'm very sorry.
You
Yeah,
can come in anytime you like.
thank you. I just want to thank all of your employees. I mean, these are incredibly difficult times, and Boston Children's Hospital is the premier children's hospital in America, probably the world. So it's a privilege for me to address the employees and the affiliated groups that you have here. I represent Alston Brighton. We have Franciscan Children's Hospital. Jim Mandel is the president of the board. He came to Franciscan from Boston Children's Hospital. And so we have a pediatric rehabilitation hospital. So when the children are done with you with surgery and whatnot, they come to our neighborhood for rehabilitation. So I didn't want to leave, Jamie, without thanking the extraordinary employees of Boston Children's Hospital. Shannon, thanks for bringing me over here. But I did not want to leave without thanking you, the frontline workers, and all the great work you do, and all the pride you bring to the city of Boston to have a hospital like yours in our midst. So thank you.
Well, I'm not sure I could have wrapped this up better than that, Rep. Honan. Thank you so much. And thank you to Monique and to Shannon and to all of you. There'll be a follow-up email. There'll be more information about the state legislature. Please reach out with questions, with stories, and with anything else. We look forward to partnering with all of you on this issue. We know it's going to be a long fight, but we're looking forward to being in it with you together. So with that, I say thank you so much. Have a good rest of your week and happy holidays, everyone.
Thank you.
Thank you.
Thank you.